Hello, hello, hello. Welcome to Talk Tuesday, 7 p.m. I think I'm going to leave this time as the regular time. I think it just works better, really. But anyway, thank you for coming on board. If you're on board, then give me some comments. You might have to give your consent to give the comments, or you can text me afterwards or inbox me afterwards, but put some likes, some hashtags or questions please today about this talk. We're going to have a brief talk about EFT. I'm not going to go into it because this is a whole workshop. This is a talk that's going to last probably about an hour or maybe 2 hours, an hour and a half, and then obviously I've got another EFT which is actually a workshop. You'll see when I put the slides up today that it's going to say EFT and matrix reimprinting. I'm not doing the matrix reimprinting. That's another day. But anyway, welcome. Thank you to all of you that have jumped on here. Just want to give you, share with you again, because I'm really into my doTERRA oil. So I'm having wild orange today. Just relaxes me. It's lovely. So we've got that little, whatever you want to call it, out of the way. Right, I want to share with you what's coming up. I have got on the 11th of June, I have got the lovely Claudia Amish Miller coming on in the Change Lounge to talk about sound therapy, which is going to be fabulous. She's very knowledgeable, very spiritual. So do join us then. It's going to be 8 o'clock on the 11th of June. And if you've got any questions that you want to know beforehand about sound therapy, then please, let me know. What I also have on the 27th of June, this is going to be via Zoom, just because of the current conditions. I've got an introduction to mindfulness meditation. So if you ever wanted to really find out a little bit more about mindfulness meditation, what it was all about, and possibly, thinking about using meditation to transform your everyday experience, then it will be very beneficial to you. So, there'll be some more posts going up about that, and there will be some links where you can click through and join. So please, feel free to do that. It's going to be good and informative, and then you can make decisions. And if nothing else, you will have a big takeaway to take away for yourself. So I hope you're all well. Let me know you're here, and if you watch it on replay, then it's #replay. So I want to talk about EFT and what EFT is all about. Okay, so I'm an advanced EFT matrix practitioner, but I'm not going to go into every slide. I want to jump through them, so at least you are informed with what is kind of what EFT is all about. And I'll give you a little exercise where you can actually use for yourself. And if you need more help, then you just need to contact me, and then maybe we'll book a session in. Oh, hi, Katie, lovely, thank you for coming on. So I wanted to sort of get on board about that and tell you about that. So in our lives, which we know, because all you know that I'm a holistic intuitive coach by now, and I work with the feeling body, we all know that in our life we have the same patterns that run through. And these patterns are formed from about the years pre-7, really, that hypnagogic stage, when we're taught what to do by mummy and daddy and parents, and we learn that behavior and we believe them. And remember when I said last week, we talked about the writing on the wall. This is very similar to that, so we repeat these patterns over and over in our life, and we keep saying to ourselves, why did I say it? Why did I do it? Why am I repeating the pattern over and over again? Because you need to go back and you need to identify and understand why this pattern is reoccurring, in your life. What is that belief that you have formed previously to obviously you being a grown adult? So I want to go through EFT, and maybe this might be a tool that you might be able to help you to overcome some of those emotional blockages that you have, because we deal with emotional blockages with EFT. So I'm not going to go into all of these things because I think a lot of you know about me, but I really must read this to you first. I understand that emotional freedom technique and matrix, which we're not doing today, are not intended to diagnose, prescribe, or treat any disease or mental illness. They are also not intended as a substitute for regular medication or psychiatric care. The workshop does not advocate the discontinuance of any prescribed education or medical psychological care. So I just have to say that to you. So emotional freedom technique. So where did emotional freedom technique begin? So it's always good and useful to know that it started back in its roots 5,000 years ago in ancient China, in the monasteries, really, where they worked on the meridians. And these are the maps of the body, which, if you'll see from the middle picture here, you know, this is where they first mapped the body and the energy centers of that body of ours. And a bit like that's when they started to use the acupuncture, or acupressure, if you like, or acupuncture, however you want to say it. It's both the same to me, to obviously relieve us of all those blockages. So we always say, the people that practice and use and are EFT practitioners, that EFT is where the two roads of the Eastern lineage, so China, India, etc., of acupuncture and acupressure, and the Western lineage of psychology meet. They come together. There is a lot of people that would actually, you know, fight against EFT, say they don't believe it, but the evidence is there. These two roads really meet together, and it's absolutely amazing. There was a doctor called Dr. Callahan, who founded what we called TFT, Thought Field Technology, many years ago. And at the time, he discovered really EFT, if you like, because he was a psychotherapist, a hypnotherapist, and so much more. And he was working with a lady called Mary. And this is well documented. You can Google this if you like. And Mary had this adverse fear of water. She couldn't even put her feet in a pond or a lake or anything. And at the time, he was actually studying the body's meridians. And during one of these sessions with Mary, he, in his mind, it just come to him to start to tap. At that time, he started to tap on the different places around, pardon me, the face and the head. But when he got to here, so this is the stomach. This is the stomach meridian. When he started to get there, she started to feel a shift in her belly. And when he tapped through this point, literally, Mary's fears of water disappeared. There's a whole nother story to it, but in base, that's how it is. And then from that, Gary Craig was a student of Dr. Callahan's, and he simplified the TFT technique, because TFT was more points on the body that you had to tap, and he created EFT, which really is a process universally applicable for all mental, emotional and physical issues. And it really does work, because I'm living proof of that. So he made this available to everybody. He didn't want it to be a secret. You know, he wanted everybody to teach it and learn it. And you don't have to be a qualified practitioner to actually use this technique. Myself, I learned from Carl Dawson, who learned from Gary Craig. And he has actually then improved on that, and he actually has added to that matrix re-imprinting. So what is emotional freedom technique? Okay, or tapping, or energy psychology, as people say. EFT is an emotional healing technique capable of dramatically relieving many physical and emotional symptoms, and it goes against the grain of all conventional psychological or psychology as we know it. And what it contends is that all negative emotions are caused by disruptions in the body's energy systems. And I absolutely believe that. You think about it, when you are feeling these emotions in your body, where are they coming from? Where are they? They're not coming out of nowhere. That abandonment, that loneliness, that resentment, that bitterness, that's come out of something that has happened to you, a limiting belief that you've held on to. So we have to learn to recognize these, become aware of them, and actually work with them in order to relieve them, so we can live a better, happier, more fulfilling life. So why EFT? EFT, what we say is that the subconscious program runs 95 to 98% of your daily behavior, my daily behavior, and our activities run automatic pilot, I would say, in mindfulness. And then many of the negative programs were imprinted with us in those first 7 years of our life, and based on the traumas, the misconception, the observations of those around us, because we believe them, we learn from these people. And these programs are based on images of the past events held in your local field, your body field, as I call it, or your subconscious. But they stay there as current events because we believe them, and our mind cannot differentiate between what is real and what is a memory. Okay, it cannot differentiate. So, you know, we always go into that fight flight when these emotions and these feelings and these memories come back up. And eventually these negative programs cause us enough stress so the body will develop a physical or psychological dis-ease. Now, that's a big word, but we get symptoms from all of these emotions that we create. And remember, from the thought, the feelings, and then the body, so it responds, okay? So this is our body, and within our body, we have this trauma that is held there. And what I would say to you is sometimes, if you've worked with me, you'll know, but sometimes I'll say, where are you feeling in your body? And if you look at people's body languages, often they'll hold their heart, they'll hold their head, they'll hold their stomach, which is an indication, but not always true, of where that trauma is being held within the body. And what happens is that trauma gets held as a limiting belief in the body and gets frozen, if you like, because all of a sudden we decide that the world is a dangerous place, that is, we are in love, or it's unlovable. And then we really go into what we call a survival strategy that we set up. And you may or may not, it may or may not be appropriate to you when you get older, but certainly when you're 3 or 5 or 2, it certainly is. So we have to recognize these limiting beliefs, you know, and work with them and see these destructive patterns that are happening with us. And really, this is what it's like. This is a diagram. It's not my diagram. It's from Carl Dawson. I have the permission to use this. So what happens is that we have a distressing memory, and that distressing memory causes a disruption in our body energy field because we believe it. So we feel it. When we see it, we believe it. It comes in through our different senses, our ears, our eyes, our mouth, our nose, our tummy, wherever. Okay. And then that results in a negative emotion. And we have to learn to actually recognize that and then work through it. So EFT offers what we consider to be remarkable consistencies with 50 to 90% of symptoms relieved with the simple routine, and it is really simple to use. You have to be specific. It is very much a verbalization and visualization technique, but once you get your routine and you learn your routine and the pattern or the setup, as we call it, you have a tool ready to use at any point in your day or your life when you are actually, you know, feeling emotions or you're feeling yourself getting distressed. We say it's acupressure without the needles, and we tap with the fingertips at various points. And these are the points that we tap on. So there is the top of the head, there is inside the eyebrow, there is outside the eyebrow, there is under the eye, under the nose, under the lip in the crevice, the collarbone in the soft spot, and then we go through to the bra strap if we want, and then into our different finger points. At the end of them, we just tap, and then back to the karate chop. Sorry, this is what we call a psychological reversal point. So how does it work? EFT is a meridian energy therapy. Just like acupuncture or acupressure, it works directly on the meridian system, which is this system here. You see, they're all identified. You can read that: the spleen, the liver, the kidneys, the heart, the lungs, the gallbladder, etc. So it works on these meridians, which represent those body systems. However, there's no need for needles. We stimulate the major meridians by tapping on them. Think of the meridians like a river. So when that river gets upset or there becomes a blockage in the health, the river will overflow. And that's what happens with your emotions. Your emotions overflow. So by us tapping, like on this diagram here, we start to release those emotions and those blockages that we have. So we tap directly on those emotions. We tap through the blockages. And if you tap with me at the end of this with an issue, a presenting issue, something that's been bothering you, or an emotion or an upset, you will see yourself how you will instantly start to get a relief. Even if you don't get complete removal of that, you will certainly get relief of that. So we just tap through it, it unblocks the channel, it clears them, and then we remove that negative emotion and restore to full health. So any questions, please let me know. If not, let me know afterwards, and I will obviously respond back to you. What can EFT be used for? All of these things here and more. Addictive cravings, allergies, anxieties, negative memories, sexual abuse, phobias, grief, loss, fear, insomnia, and so much more. Don't think, think outside the box when you're thinking about EFT. Don't think, oh, it's only suitable for X, Y, and Z, because there is so many more. And that is just a small list of things that we can use it for. So we've also got something that we call psychological reversal. So this is when you fail to progress with removing a condition, whether it is you trying to work on it in another therapy, or whether it's working on it here. But with EFT, we say be progressive, continue. So psychological reversal is when there has been a cause by fear or a traumatic block. We're not able to get rid of it. The result is a negative belief or self-sabotage behavior, which, I'm sure we can all relate to that in some way or another. It may appear resistant. You can't get rid of it. Why is it not going? But we have to persist. Common causes are depression and addiction. We characterize it by reversed energy flow. So it's like putting the batteries in backwards. So recognize this failure to progress, this failure to relieve yourself, of this trauma, these blocks. It could be past lives, it could be decisions or belief, or polarities, from switching from one extreme to another extreme. And think about it with every sort of area, in every area of your life. So if you, for example, was to move from a home country to another country, that could be a polarity switching that could be so detrimental to you and so painful. So what we say is we need to really give the psychological reversion safety, motivation, and permission for you to change and move on and be a better version of you. So in EFT, we have a basic round that we call it. And then we have, and this basic round is to treat the emotions and the physical disturbances within your body. Once you've learnt this round, you will not forget it, and you can use it anyway, as I previously said. So what we have to think about here is, what is the problem you want to work on? What is the most, some people say, most pressing issue? So it could be envy, it could be resentment, it could be nail biting, it could be, why am I always angry? It could be a multitude of things. It's for you to identify what the most pressing issue is for you. And when you know it, and even if you don't, that's another day, we can work on that, or you can ask me some questions on that. If it's just a feeling, we can work on that. But then what we have to do, we have to rate that most presenting issue. Hi, Kerry. Thanks for coming on. We have to rate that most presenting issue on a scale of 1 to 10, a SUDS level. So a unit, a subject unit of disorder. So from 1 to 10, but we'll go through that in a moment. We have to then create a setup phrase, repeat that sequence 3 times, and then check in. It's important. If you don't remember anything, when you're doing this the once, make sure that you check in, okay, and adjust the round accordingly, and keep repeating that cycle with any distress that's coming up for you or presenting problem at any level, at any time. And then, or if it doesn't move, or you have to work on it, just keep doing it, adapting it. But it is very, very important that you are specific, absolutely specific. So if that problem is in your heart, and you're feeling in your heart, and it feels like it's a black mark, and it's pain in your heart, you must use those words. It's a black pain in my heart, and then everything will start to flow as your meridians start to get unblocked, and you'll start to get thoughts relating to those emotions quite possibly. So the process. So we have SUDS level. So your goal is to have your SUDS level down between 1 and 0. We calculate the SUDS level from 1 to 10, with 1 being nothing or nearly nothing, and 10 being off the Richter scale, very emotional, very upset, very much in pain, very much distressed. So you have to rate that before we begin. And you have to feel that, okay? So what we say is, this is just an example for you, changing a habit. So notice the emotion, the abandonment issue, okay? Or whatever you're feeling about the action that you want to change. So what is the emotion that's connected to that action that you want to change? Is that anger, depression, fear, boredom, anxiety? You've got to get to know that, and only by sitting with that beforehand and accepting that and becoming aware of that are you able to be specific and work through that. So where do you feel that emotion in your body, like I was just saying? Is it in your heart? Is it in your stomach? Is it in your throat? Throat often indicates an inability to communicate. And rate it on a scale of 1 to 10. So I'm going to say, okay, in my stomach, I'm feeling kind of anxious and my stomach is churning. And right now I'm feeling that really I've got a SUDS level of 9. Okay, so it's quite high. It's very high, actually. Okay, so I've rated it. Okay, but this case, we're going to use nail biting. But I've got my own. You get your own right now. What is your SUDS level? What is your most presenting issue that you want to deal with right now? Okay. So this one, for example, is the nail biting. So this is a sort of setup that you would say. You would say a setup. So as we have a setup, we have to start to tap on a karate chop, which is this soft spot of the hand. And what we would say is, even though tapping, I feel anxious in my throat, so that's the body part we're feeling in, and I bite my nails when I'm anxious, I love and accept myself anyway. And we just keep tapping through that. Then after that, we go to the top of our head and we say things that are specific. And if it doesn't feel right, if you're working with somebody, say what you feel you need to say. So the top of the head, I hate that I bite my nails. So it's the truth. You're telling the truth about what is going on. The eyebrow, inside the eyebrow, I wish I could stop. That's a true statement. Outside the eyebrow, it seems to get worse when I'm anxious. Of course it does. Under the eye, why do I keep doing this? Under the nose, there's got to be a better way. The chin, I hate how my nails look. The collarbone, I'm letting go of the stress. Under the arm, so like where the bra strap is, what's a better action that I can take instead? Top of the head, I choose to feel surprisingly relaxed anyway. What we can do at this point, we can go onto our fingers and say other statements that are true about the most pressing issue that's coming up for you. But just be specific and be truthful about it. And then after we've done that, we take a deep breath. So record how intense the desire to bite your nails is right now. So before, for example, I might have been at a 9. Now I feel I've been doing 1 round or 3 rounds, because we do that 3 times. Then what would happen is I start to feel that my SUDS levels go down. So I don't have the same desire or intensity to bite my nails. And then I repeat that same tapping sequence, changing the setup to remaining nail biting anxiety, because you've done the first bit, this nail biting anxiety that I want to change. However it works for you, this emotion that I'm feeling, this anger that I'm feeling, even though I'm feeling all this anger, even though I'm feeling all this emotion, I love and accept myself anyway, you know, or whatever needs to come up for you, whatever makes you feel anxious, use this information to tap on. And be very specific, as I've said to you. If it doesn't seem to be working, be specific. There's no point talking about, I think, or maybe, I'm not sure. No. And if you're feeling shit, you're feeling shit. If you're feeling angry, embarrassed, ashamed, resentful, then use those words, but you don't have to use them in front of anybody else, because when you are specific, when you shout it out loud, if you can be on your own, say it out loud, and if not, say it in your mind, it's more powerful. The more emotion you have into this, the more effective it is. So be persistent. Often treatments could be repeating several times. It's not always going to knock all those dominoes down, as I say, in one foul swoop, but often it really, really does. Hi, lovelies. So check for negative belief, check for self-sabotage, you know, and if you can't get through this, then make an appointment with a therapist or a coach like me, you know, but remember, you know, to be honest with yourself, be specific, you know, whatever it is that comes up for you. And even if it's something silly, like, why do I keep feeling this in my stomach? Work with the feeling. I just feel this feeling. And then what you will find is often that memories associated with that feeling of loneliness or abandonment or resentment will come up. And then you can make the association, okay? And then what you can do, you can change around, and you can say, I see the memory of when I was a little girl. That's when my trauma began, and you can just repeat that and then go around all your different points, being specific in how you feel. I'm angry. I'm mad at my mom. I'm mad at my dad. I'm mad at my sister. I fell over. I lost the most precious thing I wanted. I made a vow. Watch out for vows. Vows are very important, and they can really debilitate us. So, you know, let's have a little go at doing, you know, around for yourself. Okay, now, and I'll do one for me. And then you can kind of learn that or copy this off here and use it. But I'm not going to go through Matrix with you today, because that's a whole new subject. We'll do that maybe another day. And it's harder for you to use this on yourself. However, I wanted to just bring a couple of slides up I have in here. And one of them is words hurt. Remember when I said about the writing on the wall last week? Remember when I said about that hypnagogic state? We learn in those first 7 years. Even in the womb, we hear things. But that's a whole new story. So when you're saying to that child, or your mother said to you, or your father said to you, or your teacher said, you're not good enough, you will never learn, those words stuck to you and they hurt. And I'm going to tell you, there's a video by Pink, and it's called Perfect. And I can't show that on here now because of obviously musical rights and so on. But look at it and think about EFT and think of those words. Just be on your own and take it all in, and believe you me, you'll probably be crying by the end of it, because you'll be able to associate it 100%, because I know I did, and I've had my clients and workshops crying or really allowing that emotion to really stir. So I'm not going to go into that. I want to just get to another part. So Perfect. Words hurt. You know, I have the scars to prove it, and that is absolutely true, you know. So let's do a demonstration, shall we? So I want you to get involved with this as well. So we'll go back to, so I want you to, let's go back to something in case you want to look at this. So what we want to do is we now want to choose a problem that is presenting itself to you, an issue that you want to work on, okay? And I'm going to choose, you don't have to tell anybody, I'm going to choose abandonment. I feel abandoned. I always feel abandoned, and when I feel abandoned, I feel anxious, you know, and I feel it in my heart, and I feel loneliness because of that abandonment. So you figure out what you want to do. And on a scale of 1 to 10, I'm going to rate that right now, because I've done a little bit of work on this. I'm going to rate it at 7. Okay. So I'm going to then choose my setup phrase, and I'm going to repeat it 3 times, and then I'm going to remove round the body. Okay. So you choose something now. Emotion, rejection, resentment, guilt, bitterness, anxiety, fear, and let me know what comes up, you know, and share with me privately or otherwise, you know, what came up for you when you did this exercise. So I'm going to do abandonment, okay, and I'm feeling it in my heart. So even though, so I'm tapping here on the psychological reversal point or the karate chop, even though I can feel this abandonment in my heart, and I feel loneliness because of it, and I feel it's followed it through my life, I love and accept myself anyway. Even though I can feel this abandonment in my heart and it shudders through the whole of my body, and for years I've felt loneliness and felt abandoned, and patterns of abandonment have repeated me, I love and accept myself anyway. Number 3, even though I feel these patterns of abandonment in my heart, I love and accept myself anyway. And at this point, I want you to pause and see if you've noticed any shifts or any emotions coming to the surface or any memories. And if you have, make a mental note of them. Then next, we're going to go to the top of the head. All this pain, all this abandonment that I'm feeling in my heart, all this sadness, I feel it in my heart. All of the tears that I've cried because of this abandonment. We're going under the chin now. Just follow me. All of this, I can feel it. And then just check in with yourself. Check in. How are you feeling now as you start to tap? Just be aware of any shifts in your body. I'm going to my collarbone. All this abandonment. Even though I've got all this abandonment and it's deep within me, I can feel it in my heart. And I feel lonely and I feel sad. Under the bra strap, tapping. This abandonment. I'm choosing to look at this abandonment now. I'm choosing to identify. Check in with yourself. Check in with yourself. Where are you as you're tapping? We're tapping on the fingers. Where are you? Think about it. With me, now I've got a shift. I've got a shift in my heart and I'm feeling that subs level now is reducing. It's going from my number 7 and I'm about, it's lowering. I'm not sure where I'm at yet. I'll mark that in a minute. And actually, what's happened? I've just got an image in my mind of a little girl that was sat on a step in Bolton wondering if her mummy was going to come and get her. And that's true. So I felt bad and she never turned up. Okay, for one reason or another, and that's another story. Okay, so I can immediately connect the dots. That is where it's coming from. Okay, so now I'm seeing it and I'm feeling all this emotion coming up. Check in with yourself. What's coming up for you? What is that emotion? Allow it to be there. Accept it. Do not push it away. Okay, and then we're going to start again because I've seen that. Even though I remember that moment and I can feel the abandonment and the pain in my heart, that my mum never turned up that day, that she couldn't, it was impossible. But I love and accept myself anyway. And we start to get a little bit more positive. Even though my mum never showed and I had all those fears of abandonment, I'm starting to feel better now. Even though I felt that abandonment in my heart, I love and accept myself anyway, top of the head. I'm choosing now to allow this abandonment to leave me. I'm feeling much better now. It's time to release that abandonment. Just working around the inner eye, the outer eye, repeating what statements are true for you. This is stomach. This is the liver. Okay, so we're here on the stomach. Okay, even though I felt this in my heart, I can feel this intensity lowering now. I can relieve myself of that abandonment now because that abandonment no longer serves me. I'm starting to feel free. I'm starting to feel freer, and I'm loving myself, and I'm offering forgiveness and letting that go. And I'm choosing, moving around the fingers, I'm choosing to heal that inner child. And I feel that she's healing now. And I love myself. Take a big, deep breath in. Close your eyes and check in with yourself. How are you feeling on that scale of 1 to 10? I can check in with myself now and feel that that abandonment issue has gone all the way down to 2, which I can live with and I'm happy with. And that feeling in my heart has shifted. So I no longer have that pain of abandonment and loneliness in my heart. Now, it may not happen as quickly as that. It may take a little bit longer, but please refer back to these slides, revert, can't get my words out, revert back to it and try the technique out and be specific with yourself. And you might have a multitude of pressing issues that you want to deal with. Just work with one after the other. If you have to write down the setup statement, write it down. But remember here, it's the basic recipe. So what is that emotion? What is the problem that's coming up for you? Get your setup stage. Repeat the sequence 3 times. Check in with your subs level. You've got to always check in to make sure that you're seeing a change, and then adjust the rounds accordingly. And as you may have to work through the most pressing negative ones quite a few times, but then after that, it'll become lighter and then you start to change it to a positive. And then you'll notice how you start to shift and memories associated sometimes. And often when we do this, we can have a domino effect. 5 or 6 emotions and things connected with that abandonment, that loneliness, that pain in the heart can drop, because that abandonment, that loneliness that I had, I attracted that more and more into my life as I grew. But now I'm older, I've learned to deal with it and work through it, and I'm free of all of that now. So for you, you know, I hope you have found that this has been useful and that you can take something away from this. And if you need further guidance, then do please let me know. But emotional freedom technique, it's an amazing therapy or technique to use that you can use on yourself. You don't always have to use with a therapist. But what I will say to you is this: we have small T's and we have big T's, okay? Only work on the small T's with yourself. If you think something is too big, you need to then go and work with a professional to work through those issues. And for me, emotional freedom technique, EFT, tapping, however you want to call it, and matrix, because I use that, but I'm not using it tonight, can be one of the therapists that can actually produce one of the fastest results for you that you want to achieve. So, my lovelies, that is the end of my little presentation to you tonight, my little talk on Talk Tuesday. So I hope you've enjoyed it. Let me know, give me some feedback. Thank you for those that are joining me, and thank you for those that are joining me on replay, and do put #replay. If there's anything else you'd like to know about it, inbox me. And remember, the 11th of June, Claudia Amish Miller talking sound therapy, and the 27th of June, we have an introduction to mindfulness meditation, which will give you great insight if you're curious into how meditation can benefit your life. So I'm going to love you, and I'm going to leave you, and I'm going to fit a washing machine, believe it or not. So have a great rest of the evening, and I look forward to speaking to you all soon. Love you lots. Mwah.